The first scientific article about TMD was published by Dr. Robert Koston in 1934. He was an ENT surgeon. I mentioned his seminal article, which described some of the symptoms and brought it to the attention of the readers that the cause was lack of dental support. In other words, missing posterior teeth. That was his theory at that time, 1934. And that's where all this started. And that's why for 2 decades it was called Koston Syndrome. Through the 30s and the 40s and into the 50s, it was better known as Koston Syndrome. The prevalence became much more common because the symptoms became more recognized. It became into view of the professions, both medical and dental profession. Primarily the dental profession started taking a look at it. In any case, the prevalence, depending on what studies you read, fall between 15 and 30% of the population. It is well known, well accepted, and again, the studies vary between what percentage is prevalent in females versus males, but generally speaking, if you talk to the average doctor who tries intuitively to treat TMD, he will say it's roughly 90% females and 10% males. And that has been my experience, personal experience after treating TMD patients, both surgically for 36 years and non-surgically for 15 years, non-surgically exclusively for 15 years, which adds up to well over 10,000 people that I've done consultations with, well over 10,000 consultations.